Welcome to another episode of the HealthCast. I'm super excited to have Dr. Patty Michelle on, CEO and founder of Health Enabled, award-winning writer, and global public health leader. Hi, Patty. Thanks for coming on.
Phil, thanks for having me.
I'm super excited to sit down with you today and get to know you a little better and learn about your work. I think I wanted to dive into your background, and because I was impressed with the work that you do and what led you down that pathway.
Sure. So I've always had like a real interest in like health and medicine and science. And so, as the a daughter of Egyptian immigrants to the United States was going to be like the family medical doctor. But I also had this like real interest in the world. Like I started traveling quite young and was really interested in, kind of like doing something kind of like out in the world. And so my vision for myself was to be like a flying doctor in Africa. That was like the image I had in my mind.
Yeah.
And I was really fortunate because I had a physics and chemistry teacher in high school, Dr. Gadabaku, who was from Liberia, who really inspired me. And as she was writing my recommendations to universities, she suggested that because of my interest in like medicine and health and the world, she was like, you should really consider working with and for the World Health Organization at
Yeah.
some point. And I had like never heard of the World Health Organization, but I had the good fortune of going to Johns Hopkins as an undergraduate and taking a course in international health my freshman year of college. And as part of that course, we had to read that year's World Development Report, which was around, this was 1993. It was on investing in health. And in it, it like systematically documented how for pennies you could save, thousands of children, millions of children, with things like, oral rehydration for diarrhea or, dehydration. How, vaccines save so many people's lives. And I just was like, wow, like instead of doing one to one, which was
Yeah.
medicine, like health is like, millions of people at a time.
I love that. What other, because you're, I was, as I was mentioning before we got on, I was just impressed with all the work that you've done. So that high school teacher, traveling as a young person with your family with Egyptian roots. So post college, take me down that path take me from the path of, I say post college to developing your business.
Sure. When I was finishing up my undergrad, I was able to graduate in 3 years and I had applied to like schools of public health to do international health. I got into Hopkins, but they told me I needed to get a year's worth of experience overseas before I could start the program. And so I went and I taught elementary school in a village in Western Kenya. It was the hardest job I've ever had, but also a lot of fun. Young people can be very, very cheeky. But it was, my hat goes off to like all the teachers out there because it's
Sure.
not an easy, not an easy job. And then, after that, I just, started traveling and working in places like South Sudan, setting up health systems, doing, I worked on the national study on perinatal and neonatal health in Egypt that led to, the Healthy Mother, Healthy Child program, which reduced child mortality and maternal mortality significantly. And so just had this like amazing, very standard kind of like global health career of research, policy, and helping to set up health facilities, etc. And then I took a break and worked for a dot com in the early 2000s in New York
Mhm.
City. I decided I wanted to like start my own dot com, but to do that I should go and like work for a dot com and learn as much as I could about what that business is like. And it was rehabmanager.com, and it was
Okay.
a site for physical therapists. and
Right.
uh
A
and I
little
was in
different than
charge of
public health.
online education,
Yeah.
and it was great. Like we worked hard, we played hard, and I learned a lot about what technology could do, but my heart was like still in the global health
Yeah.
side of things. And I had a wonderful mentor who was I think she regretted not doing her PhD, so she encouraged me to do a PhD, and she offered to write recommendations to doctoral programs. And so, I applied to Hopkins to do my PhD, and then I applied to the London School of Hygiene and Tropical Medicine. And the London School had a science and technology studies sociologist on faculty who, when he saw my proposal to study mobile phones and health, he was like, "You have to come to school here."
Yeah.
And so I did. And so I went and I studied mobile phones and health. I was the first known PhD to look at how mobile phones could be used to improve access to health services and health information. And then had just this amazing, not really thinking I was going to work on this. It was more
Mm.
like, oh, it'll be interesting. But it just turned into like an amazing field. I was approached by very early on by the World Health Organization to do a landscape of mobile phones and health.
Mhm.
They were doing a lot with telemedicine and electronic medical records. This was like in 2007, as I was finishing my PhD. And so, it started to become you know, a field. And then I, got a position at Columbia University for 4 years where I led their mobile health and telemedicine program. We had a collaboration with Ericsson, the cell phone company,
Mhm.
to do technology in 10 countries in Africa. And so I got to help set up, a mobile telemedicine program in Ghana, which still exists, and, emergency response system in Malawi, and,
Yeah.
all sorts of other programs across different countries. And then helped start the mHealth Alliance, and then I took over the mHealth Alliance as executive director. And eventually, as the field of mHealth really took off, the question wasn't like, do we need anymore. It was more like, how do we do this? And so, and it was becoming, a much bigger part of a larger field of digital health. And so we wound down the alliance, and I co-founded Health Enabled, and have been working with Health Enabled since. So for like the last 12 years or so, and there, a lot of our work is focused with governments, ministries of health in different countries to do national digital health strategies and policies. We're doing more with AI now, and we take a very strong gender intentional, equity focused approach because when we've done evaluations, what we've found is that for programs that do take this approach, the impact is much more significant on health outcomes than when you don't. And so being intentional with design is really critical.
Yeah. I think it was new to me that in mobile health that there is still some inequity. It's as much as we would hope it opened doors, but what your mission has shown that there's still a lack of accessibility for a lot of populations. I guess I hadn't thought of it that way, is what I mean to say. And so your work with Enabled Health focuses on improving access for women's health, access for, well, how'd you guys phrase it? Vaccine hesitancy? I run into that regularly in the primary care clinic, especially in the post-pandemic world. And yeah, it's kind of somewhat mind-boggling, but we try to navigate that as best as we can. Can you highlight on some of the other, or maybe break it down a little bit for me, where your efforts are focused these days with
Sure.
health?
Our work now is really focused on working with large scale, health organizations, like the World Health Organization, UNICEF, Gavi, the Vaccine Alliance,
Sure.
um, on, how to apply gender analysis and other approaches to design programs that are just much more fit for purpose. So, you were just talking about how there are these inequities. So, women are, 20% less likely to own a mobile phone in most like low and middle income countries.
Mm.
They're not represented in policymaking and or in technology design and development, but
Yeah.
they're the majority of frontline health workers. And I'm sure you can like relate to this as a frontline health worker. You have, people designing something for you to use, but you're not being engaged as part of the design process.
Yeah.
It's going to lead to, frustration, to burnout, you not being able to do the best job that you could be doing if they had just included you as part of the like
Yeah.
design process.
Yeah, that super interesting, and I think you're highlighting things that maybe being a male that I hadn't thought of in that regard, that the design layout of some of the products that are used to promote health aren't capturing the entire aren't capturing us as a population equitably across genders and
No, and it's increasing the inequity. So, I think one interesting thing is we've been doing a lot of research. I'm also on the faculty at the Johns Hopkins School of Public Health. We've been doing a lot of research where we're showing that, just by owning a mobile phone, women having mobile phones improves health outcomes for the families and without any programs attached to it. Now you can attach programs to it and then it does it even more so, which is like really interesting.
and
You
when
can attach a program to it, like you can, create like applications or other services on top of it. But even just women's mobile phone ownership, has incredible effects. But we're not really like necessarily designing for uh, equity when we're designing programs, and frankly we're designing more for efficiency, for like economic returns, but not necessarily for measurable health outcomes in like
Mhm.
an equitable fashion. The big risk we run is that as technology is becoming more and more the way of healthcare, you risk excluding entire segments of the population as a result, whether it's older adults who are not engaged as actively with technology, or it's women where sometimes the biases within like data sets put women at risk for
Mhm.
like undetected heart disease because the protocols that were developed, based on research of predominantly white men in North America. Heart disease manifests itself very differently in women. So, women will, come up much later where oftentimes the interventions don't have as significant of an impact
Yeah.
on them.
Did you have a calling to address some things, or through your career, did you notice a need and kind of gravitate towards that, or maybe a combination of both?
So, I've always been a little bit ahead of the curve. Like when I was doing my, PhD on mobile phones and health, like I was the only person. Like
Yeah,
people looked at me like I was crazy. They were
in the
just
early
like,
2000s. That's it.
"What do
That
you
space.
mean?" Like, yeah, yeah. Are you studying brain cancer? I'm like, "No, no, no, no." I'm like, if people had like mobile phones and they could access information and they could like, improve their health, like how amazing would that be? And I think I've always just like seen, in some ways, like seen opportunities that like before others see those opportunities. And
Yeah. Foresight.
and maybe I just have, like, the tenacity to hang in there long enough to see it, like, become a thing, and I think that's, kind of how, like, most of my career has gone.
What are the three subjects or efforts that Health Enable is working on currently? Improving, I think I'm not sure if it's improving health for women or so much as maybe access to health projects and health as a whole. Vaccines is what else are you guys working on currently with your efforts?
So we're like the lead steward of the Global Digital Health Monitor, which is a digital public good, one an Excellence in Research award, and the WHO has now adopted it as like the platform or standard for helping countries to measure their digital health maturity. And there, we're really trying to help countries, be much more strategic in their investments on some of the known enablers for digital health. So things like private sector engagement, having standards and focusing on interoperability of systems. We also, within the Global Digital Health Monitor, measure equity and representation of women in digital health, strategies and policies, because we know that when you do, the improvements are just much more significant. So that's like a big initiative that we
Mhm.
have. We do a lot of work with Gavi, the Vaccine Alliance, on and their 55 countries to help improve access to and delivery of vaccines, including dealing with a lot of the challenges that we're seeing with misinformation and disinformation around vaccines, and like improving service delivery quality, and and all of that. And then like more recently we've been doing a lot more work with private sector, so looking at ways to get like private sector to become much more active in the global digital health ecosystem.
Yeah.
um and because we know we need them. Like I think a lot of the ways that, for a long time I think governments were like, oh, we can do everything, but like, a ministry of health does not have the same technology expertise or capabilities that, a lot of the either the big tech companies or the startup ecosystem has.
Is your work predominantly internationally based and focused rather than domestic
It is,
or
although
global?
I've been working on something now that I'm like really excited about, more domestically, called Cultivate, which is like, an approach to uh thinking about AI and technology systems. It's a systems orientation to, embed within technology cultural norms and codes of conduct so that technology is intentionally designed to be more supportive, particularly of women in the workforce. Because what we're finding is that there's like a huge attrition rate now. There's a lot of like quiet quitting that's happening. And a lot of it is because a lot of work environments have become just much less healthy, and and a lot of the ways in which technology is being brought into the workforce is very transactional. It is not nurturing or conducive to helping people to, thrive and flourish in the workplace. And it connects very closely to some other work that a colleague of mine is doing on anti-inflammatory workplaces, to really think about how do we kind of like reduce stress in the workplace, but also create opportunities for like cohesion. And it is, you know, like when you have empathetic, companies, etc., they do, manage to increase productivity. You get higher performance.
Mhm.
It's not just like a nice to have. It's actually,
Yeah.
a business. There's a business motivation behind it. And so, yeah.
I work with some apps and business executives that are focused on basically getting healthier employees
Yep.
because how healthier, happier employees supports, increased productivity, increased revenue, less missed days at work. And it sounds like a similar concept that you're describing, but more of maybe some subtleties or some just a social environment that we encounter at work and how we interact with others, women, and so forth. The whole business dynamic. It sounds like that's what you're touching upon there to have a healthier, more productive outcome for in work environments.
Absolutely, absolutely. And it's like it's a systems focus, and it's really looking, holistically at the whole system. And so how do you engage in a participatory design where everyone can contribute to the shaping of, the norms that you want to uphold as a community, and, whether it's your workplace or anything else, and then like build those into your technology so that your technology supports those values and doesn't kind of take away from that. And then measure that, measure it and improve over time, and kind of create like a learning system around it.
Yeah. I'm going to throw another idea at you. One of the things that I'm encountering here with my work with AI, both personally and with business partners and whatnot, is that I found this really reassuring that one of the goals of AI is to, sure, it's to expedite things and administrative tasks, but really what I'm hearing from others, from leaders in that field, is there's the importance of human relationships. That's still the core of what we're working towards, hopefully, and not undermining that, or AI is not out to get your job, but to improve patient outcomes and human relationships. Is that what you're finding as well?
Absolutely. And we'll always need, humans in the loop, right? So it's, a lot of the AI work that we're seeing, and even like the more advanced AI work, like really requires people to be, looking at it. There's like an accountability piece to it. But also too, like it needs to be kind of put into its like rightful place, right? It's, a lot of health care is care. And there's like the health part of it, but then there's the care part of it. And, no amount of technology is going to be able to deliver the care that like a compassionate, caring human will be
Mm.
able to do that. And so, we need to find ways to make sure that we don't lose that caring dimension. That is like what makes us all like the beauty of like humanity is that, ability to have relationships, to cultivate supportive relationships and to have that care component.
Patty, can you talk to me about some of your drivers for you have a wide scope of things that you're taking on, and it's just cool to hear all the things that you're addressing and the positive changes that you're making in the world. And I asked you a little bit about your background initially, but
Yeah.
I just want to hit it again. Like, what are things that provide this drive for you?
So I fell in love with public health. Like I love like this notion that we have this, science and this understanding of human behavior, of disease spread, of, how things work and we can take that knowledge and we can leverage it in a really good way to like improve the health and well-being of as many people as we possibly can. And I just think that's amazing. It's this like how do we like connect these dots of knowledge and find creative ways to make people's lives like better.
Amazing.
And it's
Yeah.
just there's a definition for public health where it's like the art and the science of, of improving health and well-being. And I love that like combination of like art and
Yeah.
science and then also just the betterment of like humanity.
Yeah. Yeah, it sounds obvious, but yeah, but you're doing it. Yeah, as you were talking, I felt like I was hearing that like you're part scientist, part creative. I'm not sure artist is the right word, but just being creative with your work and that combining utilizing technology. Pretty amazing. Talk to us about some of successes that you're most proud of with your company.
Yeah, the Global Digital Health Monitor is one of them. Like we've now seen, several countries like increase in their digital health maturity, over the past 7 or 8 years. And that's been, really, really incredible. We're seeing traction in gender intentional digital health. So, we've been, working on gender studies in a few countries, including, we did one in Ethiopia this past year. And, the Ministry of Health is already taking the findings from that study to start to like improve the ecosystem for women to become much more active in digital health. And then on the creative side, I had been working with my son on like a middle grade fiction novel and about a group of kids that stop a future pandemic before it starts.
Yeah,
And I just
mom.
get very excited. I was invited, you know, a couple of weeks ago to give a book talk with a school in Japan that was reading this book, as
Oh,
part of their
Patty.
science class. And it just makes me excited to see the next generation of young people getting interested in public health and even finding their own solutions to some of today's problems.
Sure. What about maybe some challenges or points of friction that you've encountered, and whether they're recurrent?
I get very challenged when the bottom line is the priority and not people's like health and well-being. And
Sure.
so, we've seen a huge increase in things like technology facilitated gender-based violence. And the tech companies know this. And it's having this like negative effect on our girls and women, including there's like a lot more like cyberbullying that's happening with like
Yeah.
kids. And, it just like infuriates me that in this day and age, that the number one priority for a lot of companies is like making money at the expense of like people's health and well-being. And so now I have to give talks about like, gender intentional digital health and, technology facilitating gender-based violence with economic, reasons why, it's the right thing to do because because somehow like just doing the right thing is like no longer like the focus. Like it's how much money will we make or save or
Yeah.
and that that makes me it just makes me sad. It is disheartening. It's like when did we like lose our like core values as like a global society? And I know it's not like everybody, but it's just like I feel like it's just gotten much worse in like the recent like years and now it's like how do we course correct or stem the tide or do something so that we can at least like protect our young people and do whatever we can for those we care about.
How can somebody in my position, as in primary care, as a nurse practitioner, or and as a father of a 5-year-old daughter, support from a distance, support your efforts and be aware of some of the things you're working on? How can someone like me learn from your work and apply it?
Yeah, I mean, I there's so much happening in the tech space. Like I well, one, I first of all, I love that you're a nurse and I love that you have a daughter. And so, to me, it's just being really thoughtful about as you're like working on technology design and implementation, it's like really thinking about how do we start to embed, core values into the technology and how do we engage more people in like the design of the technologies that are going to like impact their lives. And then like on the advocacy side, it's really like working with your political leaders, et cetera, to advocate for more guardrails in the technology space and to try to make the technology ecosystem healthier and more supportive and conducive to young people, especially to your daughter, because I'm very concerned that like women and girls have fewer rights now than we did 5 years ago, 10 years ago. And from a health perspective, I think that's, really, really challenging. And also too that like the technologies themselves are architected against us. Like I'll give talks and I'll be like, and I'll say to the women, I'm like, if you think technology is out to get you, it is. It has been designed to prey on women as mothers and a lot of the anti-vax stuff has really leaned heavily into mothers and which is really unfortunate because like they're not even selling anything related to like anything, but it's the sorts of things that just get into the community and then spreads like wildfire and has this like very detrimental effect on our health, our children's health, etcetera.
Yeah, health of the community. It throws me when I'm in a clinic setting and I'll talk about vaccinations, and I always have to tiptoe around that. It's I try not to be forceful. I really my approach is to provide information for people to make the best decisions for themselves and their family. But
Yeah.
people will sometimes comment that they're gonna pick and choose what vaccines. I'm like, well, how are you like like that's cool if you've studied up on them, but like, are you in a position to make those decisions, and how are you picking which vaccines to obtain or not obtain? Like, I just leave it on the
Yeah.
table out there, but it always interests me how they make those choices of how they're gonna
Well,
proceed.
and they're being fed a lot of information that just
Mm.
looks very credible and it
Or
looks,
misinformation, right?
it's a lot of misinformation that is
Mhm.
like just wrong,
Mhm.
but when you read it, it's like that actually like sounds pretty good. And so it's hard to like tease that apart and to like find the signal through the noise, and there's like so much noise out there and people are much more likely to click and share misinformation. A lot of it is because it is often sensationalized and it's very fear based and so it's going to play on people's like fears and emotions
Yeah.
and I think we do need to equip like I think we did a disservice with our health professionals because we a lot of the training is not necessarily in like interpersonal communication skills, right? We're not giving like these, and people will call them we'll call them soft skills. I think they're power skills. I think we need more people who know how to talk to other people like a reasonable way and facilitate like meaningful connection and conversation, including We need health professionals who, are being trained in how to have difficult conversations because we need people to have a more positive view of and experience with vaccination because it's a life course thing now. It's not just like you have your kids and they get vaccinated. We're now, teenagers are being vaccinated, adults are being vaccinated, older adults are being
Yeah.
vaccinated. And so we need to really rethink even just how do we create more of a positive experience of immunization for people so that they do, we do go back to that time where nobody questioned, and part of it is because they did have like, polio was a very real thing.
Yeah.
And most people like knew somebody who had polio. And
Yeah.
so, that was one of the big motivators for getting vaccinated. Now people don't see the diseases, so they kind of like are like,
Yeah.
well, the reason you don't see the disease is because it was mandatory when you were a kid to get vaccinated.
I don't think people understand herd immunity and what that
Right.
means and how their choices are affecting others. I don't think that's understood well.
No, and that's like, that's one of the again, like back to like public health, that the beauty of herd immunity is that it is like, yes, my health is important and I need to do this for my health, but my health impacts your health. And therefore, I'm not only doing this for me, I'm doing this for you. And again, back to the values, like what are our core values? Do we
I
care
don't
about each other anymore?
Because they're big, yeah. I sometimes, I'm getting older, but I don't quite consider myself an old man just yet. But sometimes I'll say to my friends that I don't always recognize the world these days. It's just a different place it feels than when I was a kid or when I was younger, and it just seems off kilter and imbalanced, maybe.
Yeah, it's currently very imbalanced, and it'll be interesting to see like if and how it rebalances itself, right? But I think in whatever sphere of influence, like each of us has, we have this kind of like moral imperative to do, you know, as much good as we possibly can, for as many people as we possibly can for as long as we can.
I love that. I love that. How does the future look for health enabled? How does it, yeah, in the immediate future and long term? How does that look for you?
So immediate future, it's a tough time. Will not. I'll kid you not. We're in the middle of, public health is under attack. Global health has been completely uh, decimated and is
Word
now
decimated.
being
Yeah.
kind of put back together. We are starting to see some consolidation and some movement in key areas in technology and health. Huge desire to approach AI in a very more like localized way in countries with the right guardrails, et cetera, which is encouraging. And so we're kind of, becoming more and more actively engaged in, taking what we learned from digital health and applying it to AI. And so we're starting to get some, traction there where, last year everybody was just trying to figure out like what in the world was going on. And
I
this
hear
year
you.
we're starting to see things kind of like being put back together um in more exciting ways where countries are driving, more of the direction,
Mhm.
and I think that's important. So yeah, we'll see how it goes.
Right, one day at a time. That's what I say
Yeah,
that almost every day these days. I don't want this question to be morbid by any stretch, but what is it you hope that you want your legacy to look like? I'm just impressed with all your the work that you've done to this point and your
yeah.
drive and your desire to make a change in the world. What do you hope your legacy looks like?
I hope that as a result of the work that I've done, that as many people's lives will be healthier and that the quality of the life that they live will be, much better and more positive. And that we will have like figured out the equity question that it's not just me, myself, and I, but we are like what happens here in the United States has a significant impact on the lives of people in Rwanda, in Ghana, the Philippines, etc. And I'd really like my legacy to be one of think and act locally, but know that like whatever it is that you're doing will have like a global like impact. So like don't like, don't be us, them, like, be a collective
Yeah.
we. Like, we're all in this
I like
together.
that. That's something I try to push back on. A sense of divisiveness is really irritates me, and I try to pursue in my relationships and my interactions commonality.
Exactly.
Yeah.
Exactly. Yeah.
Thank you so much, Patty, for spending time with us today. Learned a ton, and it was a pleasure to have you on. I really appreciate it.
Thanks, Phil. And I wish you all the best. And yeah, what a great conversation.
Thank you so much. Thanks for joining us for another episode of the HealthCast, and stay tuned for more.